Minnesota State Innovation Model, Practice Facilitation, Evaluation Measurement. Today we're going to talk about evaluation measurement, which helps you to identify the elements for data collection for your trend charts or your visual displays, telling your story through data. And this document also allows you to gather all of the factual information you will need for your project to describe to your users or those that you're telling your story to exactly where the data has come from. Let's review the document. So what you see in front of you now is a evaluation measurement template. You can go ahead and put some identifying information on up front. Also call out your identified focus area, because remember, you're going to use this document to tell your story through data, so everything that you have here will be usable for your communication during the time of this project and after. Then you'll notice we move on to a SMART aim. And SMART aims, by the time you get to this document, you'll probably already have your SMART aim ready, your identified SMART aim focus area, and then you're going to review that in the documents for further reference as we go through this. You're going to notice that there's key players to involve in this work. And you've got specific people that you're going to need, because you have a QI committee, or whatever your organization calls it, that should review data on specific time frames, and that's determined specifically by every project. It could be weekly, monthly, quarterly, whatever it's defined as, and also discuss the findings. And then you're going to also create your recommendations, bring those forward on the interventions that you've selected as far as how information affects your results going forward. You're going to be bringing this forward to the quality committee. You're going to be looking at your action steps, and then you're also going to be looking at monitoring and ongoing closing the loop for your interventions, etc. So you're going to be calling that out for your quality committee. Who sits on the quality committee is determined by the organization, so take that into mind when you form your teams, and also call that out and look at that carefully. You're also going to notice we've got clinicians, nursing, health information services, EHR, or your information services, which is called various things and systems, ITS, IS, etc. Clinic staff, who's the front line? That could be anyone from who greets patients and is reception to lab, radiology, etc. So who needs to be involved, and make sure you've got the key players on the table so that they've got a voice. And do you need to add others as you go? Try and think about this up front. We're moving on again to talk about the quality committee a little bit deeper. You notice it says interdisciplinary. Just know that you need to cover all areas, because not only one focus area such as nursing can make a project go. So what else, who else is impacted, and what needs to be considered? Consider that there. Also, how frequently does your quality committee meet? That will determine kind of your reporting structure and how you communicate. So check that out and ask those questions. We move on into measurement definitions. Key part of this is arriving at your measurement definitions. You need to know, what is your patient population? This is where you consider gender, age, diagnosis. What else drives the work that you're going to be doing? What do you have to define to be very clear? And also, it gives you need to clarify who's included and who's excluded. This can be challenging, but it's very vital to have this discussion from the beginning, because you have to define where's your data coming from and who's included and who's excluded. Ways to identify patients. What is it that you're looking for? And look at your resources can be very different. Your EHR, there's other project pieces that you have within organizations, so consider that. Also, we're looking at methods of data collection. You can look at that as a retrospective chart review in your EHR, which means you go back in time, or you can do a concurrent chart review in your EHR, which means you are looking at it in real time as it's happening. And then of course, there's patient surveying, which can be done in many ways, from phone surveys to paper surveys. surveys while they're in the clinic or the hospital setting that they drop in a box, etc. So there's many options there. Also, you can look at it with your visit planning forms. There's many ways to do this, and you may have your own in your setting as well that you would use for data collection. Data collection can be done by hand with ticks and tallies, or it can be as complex as a written report that generates automatically out of your EHR. Everyone is different. When we look at sample size, consider the size of your patient population, what resources allow, whether results will be communicated as an aggregate across the site, specific by provider site, a roll-up of numerous clinics, roll-up of the entire organization. It can be as simple or as complex as it needs to be. We encourage people to start off as simplistically as possible to tell the story, and you can always increase the complexity as you need to throughout the project. Again, frequency of the data collection. Typically, it's ongoing. Is it monthly, quarterly, weekly? How have you defined it? Again, back to those definitions. And data collectors can be anyone from frontline staff, QI committee, staff folks, you name those people. Once you figure out how you're going to get it, what you're going to get, and the frequency, then you have to have that discussion as well. Where will data be shared or presented? Frequency. What is the communication plan for sharing your measurement or your data? That will look differently in every organization, so consider that up front. And you're going to look at the folks that are on your team, and you're going to have discussions within your organization, because your organization may have a standard of how they want that presented and the time frame, or you may need to tailor it based on your project and when data is available for you and ready to be presented. So consider that as well. Another key piece of this is the references, or looking at evidence-based practice guidelines, bringing those citations forward, etc. What supports the rationale of what you're doing and shares that evidence? You want to be evidence-based whenever possible, and you want to share that with those doing the work and those hearing and learning about the work as well. So when we look at this closing, this document and this video is to help you gather all the things that you will need in place to talk about measurement, data, and then be able to tell your story.